Here's a question for y'all. Besides an economics teacher, who gets paid to put people to sleep? An anesthesiologist. This year in ISM, I focused on anesthesia as my main point of study. And back when I decided to study anesthesia, when we were picking all of our topics in this class, we all came up, and myself included, we all came up with a few goals to reach for over the course of the year. And it's my belief that it really is important to have the attitude of success and positivity when pursuing a goal. That's one of the best ways to approach pursuing a goal and reaching a goal. The late Milton Berle once said, "If opportunity doesn't knock, build a door." And this is important to me, and it should be important to all of us, because it represents all of the students in this program and all of the people who are able to pursue their goals in life. We were selected to be here because we create opportunities for ourselves to succeed, and we pursue those opportunities. And with those, we can achieve our goals in this class or in life in general. Hi, my name is Evan Bradshaw, and I'm a senior at Frisco High School. This is my first year in ISM, and I'm studying anesthesiology. My hobbies include all kinds of sports. I've played a lot of sports recreationally, and I like to do pretty much anything outside. And I also love to travel. I have one brother at Reedy High School and one sister that lives in San Antonio and is married. And that's my brother, my grandfather, and I in South Africa. And then that's my family on the lake, and we always go out on the lake every summer and hang out there. So to start out, my mission statement for the Independent Study Mentorship Program is to explore and further my interest in medicine, specifically in anesthesiology, to create professional relationships in the medical field, and to learn patient etiquette in a medical setting. And that was important to me because I hadn't had the experience, and I have not had the experience of taking the medical science classes that Frisco offers because of how my schedule worked out. So this is important to me because I can build a foundation to build off of when it comes to getting into college classes that relate to medicine. So also, I will learn about the skills necessary to help people lead healthy and prosperous lives, and I will develop my work ethic and determination in order to prepare myself for a potential career in medicine and for my career in college, because that will require perseverance and a great work ethic to be able to get through the medical school needed to become a professional in medicine. And so why I chose anesthesia: I have a family history in medicine. My grandfather is a general surgeon. My grandmother used to be a emergency room nurse, and I love a technical challenge. I play soccer, and there's so much technical, there's a big technical aspect in soccer and in most sports, which is also one of the reasons why I like them. And I was interested in the psychology and people skills needed to be an anesthesiologist, because you basically have to get someone to trust you within 15 minutes with their life. So I thought that was really cool, and I thought that was a great aspect of the profession to look at. And bottom line, it's also just really simply cool. I mean, you get to deal with the latest and greatest drugs out there that in the medical field and the latest technology. So bottom line, it's also really cool. So on to my interviews. My first interview was with Dr. Tabitha Foster at Dallas Medical Center, and or Dallas Medical City, sorry. And she stressed that the patient is the priority, and that would seem fairly obvious for most professions in medicine, or almost all of them, hopefully. But she stressed that the patient should be your first priority no matter what you are doing. And that really was interesting to me, because it feels like it shouldn't have to be said. It feels like she shouldn't have to articulate that, but the fact that she does interests me, that maybe some people don't value the patient as much as they should. So that's definitely a great thing to focus on when you're going into medicine. And also she stressed that anesthesia requires a high responsibility, and you have to have self-accountability, and you have direct contact with the patient as opposed to many professions. She stressed, which was something interesting I hadn't ever heard in any of my other interviews, she stressed that the relationship with the patient is direct. With a surgeon or with most other physicians, you have either a nurse or aides that get in between that can help you when things go wrong. But with the anesthesiologist, you have direct contact with the patient. I thought that was really interesting because direct contact with a person is something that I value, and a connection with personality, that's something I value. So that was interesting to hear, and I hadn't really thought about that before. And also, she stressed that in anesthesia, you're constantly learning new things, and that you are constantly looking at new research and looking at what's to come in the medical field. And that's with almost all medical professions, because you want to have the best new techniques, research, and technology available. And so also this established a theme of inconsistent schedules that I have seen throughout, and it was really hard to get the schedule with her because she just had a million things going on, and so that kind of ingrained in me that an anesthesiologist is really hard to get to. So my next interview was with Dr. Jaime Ronderos, and he was a pediatrician for 5 years in Frisco. And he had his own practice, built his own practice completely up, and he decided to scrap the entire thing and go back to residency and switch to anesthesia, only for the reason because he wasn't happy. And that struck a chord in me, because when I do something, I like to see it through the end no matter what. I get really stubborn when it comes to those things, and that kind of taught me and showed me that it's possible to just change on a beat, and it's going to be difficult to go back and basically restart your medical career, or any career for that matter, but it can be done. And he said it was really difficult being surrounded by all these young people back in residency, because they're so young and they're just out of med school, and he said it was kind of discouraging being surrounded by that kind of life. But he pushed through it, and he obviously loves what he does because he was so just full of life and had a huge vivacity for just doing whatever he could as an anesthesiologist, and he loved talking to me about it, and I loved talking to him about it. So that was a great interview for me. He's highly stressed the trust that patients place in him, and he gave me a story about how some surgeons will, when the patient goes to sleep, they'll talk about, oh, look at this guy's tattoo, it's so cool. And he said, let's not talk about that. We're here to do a job, and let's just do that job. We're not here to talk about the person that we're operating on. So that was interesting to me because I hadn't really thought about that either. And he really stressed that trust, and that's why he said he loved the aspect of anesthesiology, because you have that trust with the patient, and the patient is placing their trust in you. He was a half independent and half not independent anesthesiologist. So he worked with other anesthesiologists, but a lot of the time he worked alone. With Dr. Foster, she worked at a hospital, so she a lot of the time worked with other anesthesiologists. So it was interesting to first see the kind of independent side of anesthesia. My third interview was with Dr. Kevin King, and he stressed to keep his eyes and options really wide open. He went into med school thinking he was going to be a surgeon, orthopedic surgeon, and he came out anesthesiologist just because he kept his options open and picked whatever interested him most. He really adamantly disliked the financial and business side of anesthesia, which probably most anesthesiologists would. That's not the reason why they got into anesthesia, but that told me that it is probably very beneficial to have a business background so that you can focus more on the anesthesia side, and the business side doesn't stress you out as much, so you can really focus on what your passion is and focus on what your interest is. And so he was an independent, and he liked it. It worked for him, but he had a very small practice, and he just operated in little surgery centers, so that worked for him. But constantly I'm seeing that independent versus working in a group, the working in a group is a lot easier and a lot more manageable, because you have people to fall back on when you have things that come up, and also you can hire people to do the business side for you. So that really helped, and I've seen that recurring throughout my interviews and throughout my mentor process. So my fourth interview was with Dr. Scott McGraw, and he works at Las Colinas Hospital, and he basically built the anesthesia program for Pinnacle Anesthesia Consultants, and he was one of the ground workers for that, and he basically built that program up. So it was nice to see an anesthesiologist that worked more than just as an anesthesiologist. He worked as an administrator within the hospital and within that group of anesthesiologists, and this interview really continued on the themes that I had already seen, like the instant gratification that anesthesiologists like. With a pediatrician or any regular doctor that you would go see for a flu, when you get the flu or something, then they keep seeing you after you go in like that. They see you for a period of maybe 5-10 years, maybe even longer, and they see you change over a long period of time, and they get that long gratification. Whereas anesthesiologists, you give them a shot of drugs and you see how happy they get and how their pain is relieved, and so anesthesiologists really like that instant gratification. They're really impatient about that, and I feel the same way about that. And also it continued with the very inconsistent schedule and very demanding schedule. My fifth interview was with Dr. Jeff Steiner, and he is my mentor. He was my favorite interview. He is a pediatrician or pediatric anesthesiologist at Children's Medical Dallas, and he really loves what he does, and I really respect that. He has an MBA, and that has helped him work his way into the corporate side of the hospital, because hospitals, I've seen throughout this process, are really becoming more and more and more corporate, and someone who has never even practiced or been a doctor may be overseeing all of your activities. So it's becoming more and more corporate, and having this MBA background is one reason why I chose him, because that's something that interests me, is having both a business and medical background, because that seems the best way to cover all your bases. And he said something really interesting about pediatrics. He was my first pediatric doctor that I interviewed, and he said something really interesting. He likes pediatrics because it's not the kid's fault. A lot of times doctors see adults that have been smoking for 10 years or drinking for forever, and they have liver problems or lung problems or whatever, and they have to correct these problems because these adults have been mistreating their bodies for so long. But the kids that he deals with can't help it. They have diseases that they can't help, and maybe inherited or whatever, but they have things that they can't help, and he liked being able to help them because they can't help but having these diseases. So that really interests me that he said that. And also he stressed in medical school and getting into medical school, he stressed to play the game, and by that he meant do what they're looking for, be a whole-rounded student, get all good grades, do the majors that they expect for the most part, and that's the best way to get into medical school, is to just play the game with them, play their game. And overall, I picked him mainly because he has business experience, is in pediatrics, which he got me interested into, and just overall we clicked. And I think one reason for that is we both have similar kind of boisterous personalities, I would say, in a way. And he, ever since I've been on mentor visits with him, I've seen his mannerisms and his professionalism. And one great example that I'm going to use is he is a really genuine person. I told him on a Monday that when I came in for a mentor visit that I was having car troubles and I had to drive a different car down there. And that came from him asking me how I was and how I was doing that week, which is in of itself a great way to let someone know that you're asking about how they are and caring for them, even if it is just simple as that. But a week later, he texted me asking me about my car, and he didn't have to do that, and it's not like it really impacted me that much, just telling him, oh, it's in the shop and it's being fixed right now, but just the fact that someone cares to ask me that and it remembers that is just really kind of inspiring, honestly, because he just is so genuine in all that he does. And I can see it when he's talking to people in the hospital. Every time we walk past someone, he greets him with a smile, and when they ask how he's doing, he says, "Oh, living the dream," every single time. And I think that's just a great model to emulate, because he's just so happy to do what he does. And I think it definitely comes from being in pediatrics, because he's happy to be around these kids and he's happy that he's really impacting their lives. So I think that's a great way to emulate, great thing to emulate, and I'm really glad that I picked him for my mentor, because I think that's really important in life, is to just be happy about what you're doing and be excited every single day to go into work. So that is a great thing that I really am looking forward to experiencing more when I go on more mentor visits. And so past my interviews, before I go on to research, my themes throughout the interviews that I have seen is that the patients are the absolute priority, that they should be the number one thing that you're thinking about in the operating room or in the hospital or wherever. And anesthesiologists have a highly variable schedule, whether you're on call or not. You can be extremely subject to the scheduling and the demands that the scheduling has on you. And also, medicine in general is becoming increasingly corporate run, especially in hospitals. And anesthesiologists like what they do for a big reason, because it gives them immediate results and that immediate gratification. And so on to my research. My first assessment was kind of delving into why I originally picked anesthesia, which is the patient-physician interaction. And it was called Introducing a Teaching Module to Impart Communication Skills in the Learning Anesthesiologist. And basically, it was about how the anesthesiologist talks to the patient and how that affects the patient's overall experience with the surgery and post-surgery pain levels. And so when the anesthesiologists use negatively connotated words like needle and like prick and inject, then the patients overall experience more pain during and after the procedure. But when they use kind of softer, less negatively connotated words, the patients felt a lot less pain and felt a lot better after their procedure. So that was really interesting to me, because just a simple change in words can be so psychologically different, and that's one of the main reasons why I got anesthesia in the first place, and I've grown to find more interest in it. But that first thing that I really looked at was the psychological side, and that really interests me. And this just shows that communication is probably one of the most important factors when it comes to anesthesia with the patient and with the surgeons in the room as well, because you have to be very vigilant on what is going on and be able to communicate that. My third research assessment was called A Double-Edged Sword: Volatile Anesthetic Effects on the Neonatal Brain. And this was about the kind of current debate in anesthesia, where you have general anesthesia in children, and so this was a pediatric study. You have anesthesia, general anesthesia. There have been research that shows that giving children general anesthesia may lead to degeneration in their brain further on later when they get older. And so very few studies have actually been conducted, because it's extremely hard to conduct these studies over such a long period of time. But some are being conducted, and some have been conducted in mice and rats as clinical trials. But some human clinical trials are going on right now, and it's very hard to quantify that because it just covers such a long period of time. But also at the same time, these general anesthetics have been also shown to protect against cerebral ischemia, and that's right there. You can see on the left side of the brain right there, that's all blood that's flooding into the brain, and volatile anesthetics have been shown to protect against that, but at the same time they may lead to long-term neural degeneration. So there's kind of a double-edged sword with that, as the name of the article implies. And so that's kind of the ongoing debate in anesthesia right now. And so that was really interesting to kind of see the current events that are going on with that. And my 5th research assessment was emergence and recovery from anesthesia for pediatric patients in the post-anesthesia care unit, or the PACU. And this one was basically because I knew, by this time I knew that I wanted to ask Dr. Steiner to be my mentor, and obviously he's in pediatrics. So by this time I wanted to kind of sway towards pediatrics, and this article was basically introducing me to the difference between pediatric anesthesia and regular anesthesia. And basically the point was that pediatrics is a completely different animal. You can't expect the same thing out of regular and pediatrics at all. There are completely different complications that come up and completely different techniques and procedures that you have to do. And so this article stressed that a lot of the times some people expect it to be kind of the same, and then they go into pediatrics and they're kind of blindsided by how different it is. And also a lot of the times children are unfortunately being treated in hospitals built for adults. So anesthesiologists really have to know what they're doing and be able to adapt to the change from regular anesthesia to pediatric anesthesia in a hospital that isn't built for children. And so in Dallas, fortunately in Dallas, we have lots of children's hospitals, one in Plano, and there's Children's Medical Center Dallas. And so fortunately we have tons of hospitals in the area to be able to treat children in a setting that is for children. And so that was basically my introduction to pediatric anesthesia. And my themes throughout the research that I've seen is that it is an extremely technical practice. It takes extreme focus and laser vision to be able to basically see everything that is going on with your patient, everything that is going on in the operating room, and how to respond to different complications. Also, anesthesia is constantly changing. It's one of the aspects of medicine that is constantly adapting to itself, and really when you come out with new technology and new techniques, it's constantly shifting and back and forth between different things. And also it's multidimensional, and by that I mean it really has different perspectives that you can look at it from, which some medicine isn't like that, but anesthesia really is, because there's different ways you can look at it from regular to pediatric, or different views on how a certain technique will work, or things like that. So it's definitely very multidimensional and very complex when it comes to that. So on to my original work. My original work was originally drawn from my first interest in anesthesia, which was the unique patient-physician interaction that you don't really get to see in most other interactions. And so I continued this interest into my original work. So basically, I designed a survey to assess parent satisfaction with the entire process of their child undergoing surgery. And I planned the survey because I wanted to actually conduct the survey to help Dr. Steiner and other physicians, especially at Children's, know what parents are liking and disliking about the entire process. So I basically planned out the survey and how I was going to conduct it. And so I was originally going, because my topic is obviously anesthesia, I was originally going to limit the survey to only anesthesia, but then I realized two things. One, I realized that it would be able to reach a lot more physicians and be able to help many more physicians if I widened the scope to mostly general surgery, not pediatric versus general, but like the anesthesia, the surgery, and the post-surgery processes. So I widened the survey to be able to account for all those aspects. And also I realized that most people probably don't think about the anesthesia too much. They're probably worried more about the specific surgery that their child is undergoing, so they're probably not too fluent on what the anesthesia process is. So having an entire survey on it would be kind of overkill, because they may not be knowing what they're talking about. So for those two reasons, I decided to widen the scope of the survey. And so there it is right there. I kept it pretty short because I wanted for people to be able to answer it pretty fast right before when they're in the pre-operating stage, or in the post-op, and in the post-op rather. So I have one entire page for pre-op and one entire page for post-op. And it was really kind of complicated how we had to design it, because we had to ask questions that they could answer in an open way, but also we had to ask questions that could be quantifiable and measured, because you can't really measure an open-ended question. So we had to incorporate ways to be able to figure out how to do that. So that was interesting to learn about, because like I said through here, themes throughout the original work, it is very detail oriented, and every detail matters depending on how you ask the question, to what order you ask the question in, to what answers you provide in the question. It is very extremely detail oriented. And also, I've learned throughout this that medical research takes extremely careful planning, and you have to go through so much red tape for good reason to be able to conduct research, because you don't want to have abused a patient's rights to their information and things like that. So you have to be very cognizant of what you're asking. And like I said, you must always have the patient's best interests in mind when it comes to that, so you can't be violating their personal information rights just because you want to conduct research. You have to be able to limit yourself and limit your research to only what it needs. And I've learned about that through different modules and courses that I've had to take. And also, there is no perfect research method. There are going to be flaws to every research thing, but if you can limit your flaws and put your flaws in ways, shape them in ways that don't affect the survey or the research as much as a whole, that's the best outcome. That's the most favorable outcome that you can have. But there is no perfect research method for anything, unfortunately. And so, moving on, I hope to use that survey that I've made to actually get results from real patients and real parents in the process, to be able to create a thing to give out to doctors, maybe an article or a brochure or something, or maybe Dr. Steiner and I have even talked about publishing an abstract to be able to get this information out to doctors to help them really know what their patients are thinking. And so basically, generally in ISM, my goals are to gain experience in the medical field, like I said, meet contacts and network within the medical field, which will really help me down the line when it comes to getting into medical school for rec letters and things like that. And also, I want to learn about different specialties of medicine along with anesthesia, because we're only in high school, and I may want to do a completely different thing other than anesthesia. So I want to keep my eyes open and looking at other subjects too. After ISM, I hope to attend the University of Texas at Austin and hopefully go to medical school, maybe with a business background. I'm not entirely sure yet, but I hope to basically keep my eyes open and basically keep my options open. And so in that way, I can have multiple options. Thank you for attending my speech, and thank you for listening. Thank you.